Hello everyone, how are you doing today? This is Juan Manriquez with Elite Medical Workshops. I'm super happy to have you here and thank you so much for watching our webinar where we are going to learn everything about in-office liposuction. You know that in-office liposuction is a procedure that is bringing a lot of revenue to the med spa industry, and that is why all the time more and more doctors are trying to learn about this topic. Today we have a very good instructor for you today. Is Dr. Yanessa Yanitelli. She's from Scottsdale, Arizona. She's been doing this procedure for over 10 years and is a national instructor in high definition liposuction. I'm here to introduce you today with Dr. Yanessa Yanitelli. So Dr. Yanessa, thank you so much for being here with us and sharing your variable pearls. I'm not gonna say more, just introduce yourself. Thank you.
Hi, my name is Dr. Yanessa Yanitelli. Thank you so much for joining me today. So I myself am a regenerative and cosmetic medicine specialist, and I've been doing liposuction for about a decade now. And when we get into the types of liposuction devices, I will tell you about what type I use and why.
Thank you, Dr. Yanessa. What a great introduction. I can't be more excited to have you here as part of our faculty in Elite Medical Workshops. Going a little bit into the theme, I would like you to talk a little bit about the history of liposuction. How has it evolved over time, and how has technology become more efficient so physicians can have better results with this procedure? What can you tell us about this?
A little bit on the types of devices that are on the market currently. There is traditional liposuction. That is the old school, in and out, using your muscles. May have turned your stomach a little bit in some videos, but liposuction has come a long way since then. We also have power-assisted liposuction, laser-assisted liposuction, ultrasound-assisted liposuction, water-assisted liposuction, and also vibration-assisted liposuction. So a little bit going back into the history of how liposuction started and sort of the evolution. Liposuction's actually been around for quite some time. Back in the very beginning, when they were doing fat removal, they were actually doing a cut and scrape method. So this had to be done in the hospital under general anesthesia, was very dangerous, had a high complication rate. That transitioned in the late 1970s into dry liposuction, where they still were having to do blood transfusions. This had to be done under general anesthesia, still a very dangerous type of procedure. Until in the mid-1980s, Dr. Jeffrey Klein came along. He's a dermatologist, and he actually is the godfather of what we call the Tumescent technique, or modern liposuction. And what that means is that at that point in time, we started injecting a solution of lidocaine and epinephrine to do some local anesthesia for the area, and also to constrict the blood vessels so that you got significantly less blood loss and just very minimal blood loss. So that technique has been around for almost 40 years now. Great, excellent safety record. Once we got into the early 1990s, then that's when ultrasonic and laser-assisted liposuction devices came around. In the mid-90s, we had water and power-assisted coming onto the market, and then most recently in 2015, fun sculpting, which is an amplitude or vibration-assisted liposuction.
Wow, amazing. We have a lot of different options out there in the market. So I think it's very important for you to share with our audience what will be the facts to help them select what type of device is there and it's available and it's more efficient for them to choose if they are thinking of starting to implement this procedure in their med spas. What can you tell us about this?
So there are a lot of factors that you need to look at when you are looking at what type of liposuction equipment you want to bring into your practice and what's going to best suit your needs and your patient's needs. That is going to be how the emulsification of the fat is being done, how the patients tolerate each device, what is the aspiration rate, meaning how much fat can you suck out in a period of time, what type of volume can you get overall for your case. what patients are going to be good candidates for that device, because not every single device has the same patient criteria. Also, is there a risk of burns, seromas? What's the total surgical time required that you are going to have to put in as a physician and block out? Also, what's the cost of the device? And probably most importantly, are there disposables? And what are the cost of those disposables going to be?
So with all this information that we have in place right now, I think it's important for us to describe each type of procedure and show its pros and cons. So let's start with the old school liposuction. What can you tell us about this?
So in traditional liposuction, like I said, that's that old school one where hope you're going to the gym and doing lots of bicep curls, because that's all going to be manual force. It was very exhausting for the physicians to do these types of cases, very time consuming. There really wasn't any good skin tightening component to that type of liposuction. Also too, just because of the aggressiveness of the physicality of it, there was also a lot of damage to the underlying tissues and underlying structures, meaning that the patients eventually had a lot more pain, downtime, bruising, discomfort, and just didn't tolerate or like the procedures as much. However, the one benefit was not a lot of disposables. So ultrasound liposuction. So this type of liposuction is actually going to use ultrasonic energy to emulsify the fat, and then the provider is going to come back in and suck the fat out later. The problem with ultrasound assisted liposuction and some of the other liposuctions that we'll go over here in a minute is that those types of tips get hot. So you have to put metal ports in to protect the skins. They can cause burns. They can damage significantly the underlying tissue that's part of the device. So while they speed up the rate of fat aspiration that you can get by emulsifying it, it's also causing a significant degree of damage to the tissues, which again is going to lead to increased bruising, increased swelling, and more downtime and discomfort for your patient. Also too, this type of device has a limitation on the BMI, so patients generally need to be in that 26 range on their BMI, so it's going to greatly limit your ability to treat overweight patients with that type of device. The other thing is that it has a very high repair and replacement cost, as well as disposables. So the disposables can be somewhere between $400 and $600 for each case, and that's not including the general consumables that every type of liposuction case takes. This is independent on its own of that particular device. Also, it's not a good pairing if you are planning on doing fat transfer to the breast, to the butt, to the face. It causes a lot of damage to those fat cells when they are being removed, and therefore the viability significantly decreases when those are transferred into the patient.
I've been seeing there that there are a lot of surgeons that are using the power-assisted liposuction. What can you tell us about this procedure? And what would you say it's, let's talk about pros and cons about this procedure as well, and these devices that are there in the market with power-assisted liposuction.
All right, on to power-assisted liposuction. So this is going just to be a rapid back and forth of that cannula with an electric device. It's just like using a jackhammer, but into your patient. So that again is going to cause significant damage to the tissue, not good cell viability there for transfer as well. As a bonus, there isn't any additional disposable fees for this device, but there are high replacement costs if the device is damaged.
When we talk about in-office liposuction, we always tend to think about smart lipo or a happy lipo or all these type of laser policies that are available there in the market. This is, I will say, the most popular version of in-office liposuction. What can you tell us about this procedure?
onto laser lipolysis. So this is another one where we're not using ultrasound energy, but we're using laser energy to cause destruction of those fat cells. It basically melts the fat cells. The provider then goes in secondarily and does the suction portion of the procedure. But when they're doing that, again, they're destroying all of that connective tissue, those micro nerves, micro blood cells, just causing a lot more damage to the tissues, again, leading to that extended recovery and more painful recovery for the patient. This one does not have a high aspiration rate, meaning that you could be in that case for a long period of time trying to yield the same results that you can get with other devices in a significantly shorter period of time. This is another one of those devices where you have to use ports for the skin. It can cause burns, seromas. You do have to be careful with this type of device, as well as the ultrasonic devices on darker skin clientele. Even someone like myself, I'm half Italian, I'm a Fitzpatrick 4. Once you get someone like me or up, there is a much higher chance of permanent pigment disruption in those patients, and they will not like you for that. Also too, with these ones, there is going to be a disposable cost above and beyond your regular supplies, and those are for those fiber optic tips, and those can range anywhere between $250 and $700 per tip, depending on the device, and that's going to come straight off of your profit margin. All right, so some of the ones that you might have heard in that category are going to be Smart Lipo, Cool Lipo, Slim Lipo, Pro Lipo. We could kind of go on. Zerone is another one that was around for a while. Alma also has one called Beautiful.
Thank you so much for sharing all this valuable information. I'm sure our audience is super happy with all the pearls that you're sharing. Now I have a tricky question for you, doctor. According to your experience and knowledge, what will be your preferred device to choose, especially if you're considering implementing this procedure in your practice for the first time? What can you tell us about this question?
It's fun sculpting, that is the amplitude or vibration assisted liposuction, and that tip has a few different types of benefits to it. First of all, it does not get hot. It actually whips in a 360 degree range, and you as a physician can control that range depending on what part of the body you're trying to sculpt, how much fat you're trying to sculpt at one time. There are no heat production with this tip, so you don't have to put ports in, you don't have to worry about burns, you don't have to worry about Fitzpatrick type. Another great thing with this one is there's going to be no BMI restriction, so you can do obese patients, you can do older patients, as long as they are in relatively good health. There is not that restriction based off of BMI for patient selection, which is going to open things up significantly for you. It is great for fat transfer because, again, the way that this works is sort of like shaking grapes off of a vine. Those grapes are going to drop off, be whole in most cases, and the survivability of the fat is going to go up into the 85 or 90% range. Whereas if you look at quotes from previous literature, it's somewhere between 40 to 60% of the fat that was transferred was dying, which is why fat transfer sort of got a bad name to start out with. But with this particular device, you have high survivability. Your results are going to be long lasting. Another great part of this device is that the infiltration piece, which is going to be putting in that tumescent solution or that numbing solution that you're going to use, is actually integrated into the machine and can also be used at the end of the case to do those fat transfers directly through that pump. So if you've used other devices in the past, if you've seen fat transfer cases in the past, it's the way that I used to have to do my fat transfer cases. You're loading up 60 cc syringes and using a ratchet gun. It's a very time-consuming, messy process that just extends the case for a significant period of time. Now with this device, you can just load the fat into a sterile canister instead of one of your disposable canisters. You use that infiltration pump at the end of the case and you literally pump it right back into the patient. Less touch points for the fat as well, just increasing the survivability, the ease for the patient, and also the ease for the physician. Another cool thing about the vibration, and a reason why we don't use IV or general anesthesia, we only use oral sedation, is going to be related to the way that the vibration affects the pain receptors in our body. So it's kind of one of those tricks. When that vibration is around, your brain is going to be sensing that vibratory component and it's not going to be sensing that pain. A lot of you guys have learned about the gate control theory of pain, and that's basically what we're talking about in this particular instance, but greatly decreases the patient's pain and pain levels and discomfort during the procedure, making it great for in-office. The other great thing too is if you are planning on pairing this device with other devices like Renuvian in the future, it leaves all of that connective tissue intact, which is what those types of skin tightening devices and other devices use. So in my opinion, this device also has superior pairing with other minimally invasive devices. So it allows you to have just a wider range of flexibility and superior results to your peers that are pairing those types of devices with more destructive liposuction devices. So just sort of as a summary for all of those things, there's going to be decreased pain because of that vibrational anesthesia that's going on. It's faster. A lot of the other devices, you are going to get really slow aspiration rates out. In the beginning of cases, you can get 1 liter in 10 minutes, which was almost unheard of in other types of devices. So it's going to speed up your case, speed up the number of cases you're able to do in a day. And it's also going to decrease physician fatigue, because at the end of the day, we're humans too. We're performing the procedures, and there is effort that is put into this. So this is going to greatly decrease that effort that's put in by the physician. You are going to get that extra added benefit of some mechanical stimulation to cause skin tightening. So these people are going to get more skin tightening with this device alone than if they went out and lost the weight on their own at the gym. It's also a great replacement for people that need tummy tucks. So in the past, you would have to do liposuction followed by an abdominoplasty. Now, most candidates, unless they have just an extensive amount of skin, can get amazing results with this device and not have to have that invasive surgical procedure following it, which makes it not only great for recovery, downtime, but also for cost for the patient. It makes it very attractive. There are heating plates on this device as well, so you don't have to microwave bags. It's keeping it nice and warm so that your patients don't have any chance for hypothermia or disruption of perfect core temperatures, which is also very important. It's going to decrease bleeding and bruising, which means, again, clients are going to have less downtime, less discomfort with their downtime. They're going to talk to their friends about it more. They're going to do more referrals. They're going to be happier overall with the case. Also less cost for the physician, because again, there are no disposables with this device except for, the hoses, tubing, things that go along with every type of device, but no separate disposable that has to be purchased from the company for each individual case.
Wow, it's incredible how technology has evolved over the time. I will never think that you can get and achieve this wow factor and amazing results with an in-office procedure with little to no risk. It's incredible, really. What else can you tell our audience about this procedure?
I think that's about it. Also too, for decreased fibrosis for repeat. So you will find that you will have a lot of clients that will want to come back over the years and do repeat procedures. In fact, I just had a client from 4 or 5 years ago come back. He's put on a little bit of extra weight over the years, and now he wants to repeat liposuction in that same area. It's going to allow me to cut through that tissue beautifully, and also from doing that procedure with that device earlier, he's not going to have as much scar tissue to cut through. The other great thing about this device, it's beautiful for both men, women, for both debulking and sculpting. And you can also see in the pictures that are attached, we can do some really fun stuff with abdominal etching in guys. A lot of men really struggle, especially once they get into their 40s and beyond, with getting that really etched look that they used to be able to get easily, or maybe they were never able to achieve that at all. You can go in and do abdominal etching, and these guys are going to look like they have an instant six-pack and love you for life. Also too, if you look at the long-term retention for both the Brazilian butt lifts and the fat transfer to the breast, much safer, no need to go into the future and remove implants that have been around for too long. It's their own natural tissue that's in there. No problems again too with silicone implants moving around in the butt, causing problems, having to be removed. None of that, their own natural tissue at a much higher rate of viability. So again, this is where I was talking about that wow factor. If you look at the abdominal etching, it's a wow factor. If you look at the skin retraction that you can achieve with this device on its own, wow factor. If you look at the amount of fat that we can take off an obese person, we're making huge changes in these people's lives. I've even done some cases on people that are wheelchair bound now, or partially wheelchair bound, and it can completely change their ability to ambulate on their own. It just has such a wide range of uses and clientele that it can be used on. And you really just, the difference is blatantly obvious and will really garner you repeat customers and very happy clientele with this type of device and being able to use it on such a wide range of patients. And again, too, older patients that would not be candidates, period, because of the risks for IV and general anesthesia can also do these devices. So we have people living longer and longer, and 70s, the new 60s. So those patients in their 70s that are in good health, I've done even people in their early 80s and they've tolerated it beautifully. So just really nice variability for uses in your clients.
Thank you so much for staying tuned in our webinar about liposuction. I have an amazing promotion to share with you today. Only for $299, you can get access to our online course in our liposuction masterclass, where you're gonna learn with Dr. Yanessa Yanitelli everything about liposuction. You can get certified with this course. So take advantage of the promotion. Look at the screen. Everything that we offer with this course is an amazing opportunity. The value for this course is $2,000, and you can get it today only for $299. So take advantage of the promotion, guys. I'm looking forward to working with you in your certification progress.